Heading to DC to pick my mama up. She stayed at Georgetown University Hospital. I should have been got a what is it? Stand. Let her stay there over the weekend. They did do her dialysis. They've been giving her a little sugar water, so a little small amounts of fluid. They said that they wouldn't be able to help us with their vascular issues or any of the wounds that we are having problems with. She's been having a lot of diarrhea, chronic diarrhea from being on antibiotics. And, they tested her for C. diff, which I already told them it was negative. We've been tested for C. diff, I don't know how many times over the past few months. She has diarrhea from the antibiotics. Then she gets diarrhea because she's lactose too. So that's why she lost so much weight, because these hospitals keep giving her pudding. They keep giving her pudding, and the pudding adds to makes her have even more diarrhea. Like last night, the nurse said she was, giving her chocolate pudding. The day before, the nurse said she fed her chocolate pudding and ice cream, and so she's on a liquid diet. But I asked them, if she's on a liquid diet and if she can swallow chocolate pudding, she can swallow pureed meats or vegetables. But the doctors won't order her any kind of, or the dietitian won't, put her on a pureed diet so she could get some nutrition. They just have her on this liquid diet that's only going to make her have even more diarrhea. Because if it goes in liquid, it's going to come out liquid. But it's a struggle. Then with the reflux, they speech evaluates her and says she can't swallow, but I had already made it known that if her reflux isn't covered with the omeprazole, then she, has swallowing issues. So instead of covering her reflux, they just said, well, she's at risk for aspirating and nothing by mouth. So she's having all this diarrhea, not being able to have anything by mouth except chocolate pudding that gives more diarrhea. And then they're doing the peritoneal dialysis that's taking out even more. So, she has to be really strong to even, still be able to be conscious. They're just doing just enough just to keep her hanging on, not giving her things. Her knowing if she struggled to swallow, let her, all of her medicines that can be IV, let them be IV. Somebody who didn't go to school for medicine has to suggest it. But these people, they went to school for all these years and they don't know that. I have to tell them that or ask them to do that. I've been asking for something to stop the diarrhea. They won't give her anything to stop the diarrhea. It's like they just trying to break my mama down, like they sucking all the life out of her. Like I was saying, that they'll try to act like they doing something to help, but they just doing just enough to keep her hanging on. Not doing things that she really needs, like nutrition. And then the provider put a tube down her nose, the feeding tube down her nose, which is very irritating. But she put it in the wrong place, so that couldn't stay there. So just unnecessary torture. But then I can't be with them. My mom, has dementia. dementia when she's weak or confused, and I can't be with her, so she can't speak for herself. And then it's really even hard to get the nurses. Like I called the nurses, for a whole shift, and they never call back. So I'm going to get her. Before they'll be calling soon, saying, well, your mom, isn't doing too good. They're waiting to make that call for me. That's why they won't give her any nutrition, because everybody is a major part of healing. They don't want her to heal. They're tired of her. They're tired of me, bringing her to their healthcare system. It's people in healthcare. They're not here to help. They'll help the ones that they feel, that they should help or that are important. But my little black, poor mama, she's not important enough to help or waste time on. So, I call them money monsters. They're all about money.